Hey everybody, welcome back to another episode of Tattoos and Telehealth. I am Kelly White, and this is my great friend and colleague Nicole Baldwin. And we are both board certified family nurse practitioners. And before we get started, our lawyers always make us say this episode does not constitute a patient-provider relationship. This also does not constitute any type of medical advice. This is just a couple of friends. We're chatting it up, talking about some things that may or may not be beneficial. We always recommend that you visit with your primary provider who knows you best. So if you have any questions, we are always happy to talk about them. If you want to throw your comments, questions in the chat box below, always like, subscribe, follow us. But as always, check with your primary provider before you institute anything that we talk about. So today I want to visit a little bit about the big differences in telemedicine. So as the world of telemedicine continues to grow, Nicole, we're starting to see a big influx of people that have realized telemedicine can be accessed for a lot of things. But having said that, there are three very, very specific pieces of medicine. So there's acute care, there is urgent care, and there is emergent care. And so really quickly, I want you to take us through what in your world, in the world of telemedicine, is acute care versus what is urgent. This is not necessarily a trip to the ER, but maybe probably a little bit more significant, needs to be seen in person. And then don't pass, don't collect $200, go straight to the ER.
Sure. So urgent care is designed for non-life-threatening conditions that still need prompt attention. These are going to be things like sinus infections, UTIs that are very simple, just starting, things that we can bridge that you would usually maybe call your primary and say, hey, can I come in today and see? Just simple infections. Acute care is more like a bone fracture, things like that, where somebody needs to be seen in person. Somebody really needs to, you're going to need an x-ray, you're going to need imaging, things like that. But very, very similar to urgent care, that is. Urgent care, emergency care is the things that are life-threatening conditions, serious injuries, things like that. Shortness of breath, chest pain, acute trauma, things like that, that it's just not going to be wise to even wait for a telehealth provider. Even if it's right now, it's still beyond what we are able to do, the limitations of telehealth. So with telehealth, we can provide a ton of things because the ERs are packed. The most sick are getting back first, which they should. If you're in the waiting room, consider yourself blessed. But telehealth can help with a lot of the urgent things, I need a refill on my blood pressure medication. I'm not feeling well. I'm nauseous. I have a sinus infection. I am just not feeling well overall. I think I have the flu. Things like that is certainly an urgent care where it's not necessarily life-threatening right now, but you definitely need to be seen by somebody. And that's where the telehealth falls. We can keep you out of the emergency room. We can keep you even out of urgent care. But it is important to utilize the urgent cares, the in-person acute care and emergency care in the right way. And just to make sure that you don't want to go and wait in an emergency room for hours and hours over a sinus infection, but a telehealth visit or an urgent care facility would be much quicker. And in most cases, telehealth is way cheaper, depending on your insurance.
And a lot of times we'll even say when you come to see us via telehealth, if you have something that's recurrent, this has gone on a couple times, we may still pump you to go back and see that walk-in clinic, not necessarily the ER, but we may say it's time to go be seen in person because we need someone to lay hands on you. We need someone to check your urine. We need someone to listen to your lungs. We need someone to check your kidneys. There's just limitations in this world where it may have started out as a simple UTI. It may have started out as a simple sinus infection, ear infection, strep throat, but now it's turning into something that you're coming back, weeks have passed, and you're still not getting better. While it's still not an emergency, Nicole or I may say it's time to go be seen in person. And we're not doing that to be ugly. We're not doing that to say we can't help you. We're just saying this now has transitioned into something just a little bit more acute. And we need you to go be seen in person. And that's why those walk-in clinics, urgent care clinics can become very, very beneficial in that next step. We're still trying to keep you out of the hospital, but those times become very necessary.
Even now, there's, at least in my state, and I'm sure maybe it's in your state too, I don't know, but they're doing these freestanding ERs now where it's not a whole hospital, it's just a freestanding ER. And we had to use one, my husband and I had to use one a couple of years ago, and it was so much faster. It was so much faster than the regular hospital. And so those are great. Those are great for those in between things. They will transport you to a bigger hospital if it's warranted, but those are a great pit stop in between. I'm not really sure. Go to a freestanding. They have capabilities. And if things like if you need a specialist or anything like that, they will certainly transport you in most cases to a larger facility. Just like any hospital, if you go to a small rural hospital, if they don't have your specialty on staff, they'll transfer you to another hospital that does. And so it's kind of similar in that way, but a lot of times they can do a lot of things. I know I've had some relatives go there and they've just been maybe severely dehydrated. They keep them for 4 to 6 hours, give them fluids, have them follow up, whatever. But it's been able to keep them out of the big ERs. And it's been so much nicer experience that because you're not just waiting in a waiting room with a bunch of sick people.
For sure. And I also think that it helps to bridge that gap still. You have those freestanding ERs and it just doesn't feel like you're having to quote unquote go to the hospital. You still get that emergency medicine without feeling like I'm going to the hospital. I really like that concept.
So there's Telehealth, which is for most things, most things. And then there is your walk-in urgent care, right? Which is for the little bit more things that may need an x-ray or maybe things that aren't really urgent, like things that aren't emergent, sorry, things that aren't emergent. And then things that are emergent, you can go to the freestanding or you can go to the big hospital. Either one of those is going to be a great option. Whatever's closest to you in an emergent situation, go there. Whatever's closest to you. But telehealth can take a lot of the load off of waiting for primary care and just waiting in those ERs. When urgent care sometimes can get super busy too. So sometimes it's just a good idea just to at least explore it. But anytime you have stroke symptoms, shortness of breath, chest pain, anything similar or anything like that, definitely seek emergency care. And that is not through telehealth or urgent care facility.
And always a good rule of thumb, Nicole and I are always here to answer any questions you guys have. Our team is on standby to answer your questions. If you're just unsure, you can always chat in, create a quick profile, and let the team know, hey, this is what's going on. Can you guys take care of this or do I need to go be seen? They're really great to pop in and say, no, you should probably go be seen in person, or hey, Nicole or Kelly can take care of that. And so it's quick. It's something that we don't mind doing. You're not going to pay for that opinion. It is just an opinion for us to say, no, you need to go be seen, or yeah, we can take care of that. And so it's always easy to ask this question, guys. If you have any concerns, just let us know. As always, we're here to take care of you. If you have any questions, comments, concerns, please just comment below. Subscribe, give us a follow. You can find us at hamiltontelehealth.com. If anybody has any concerns, please just hop in. We're happy to have you here, and we look forward to talking to you again soon.
Thanks for joining us. Have a good day.